Thank you so much for joining me today. July is Uterine Fibroid Awareness Month, and uterine fibroids affect millions of women. Yet, many people may not fully understand what they are or how they can impact a person's health. So, I'd like to start here. Can you explain what uterine fibroids are and what people should know about them?
Yeah, first of all, thanks for having me. It's great to be able to educate people about fibroids. So fibroids are basically benign, non-cancerous growths within the uterus. They have a consistency almost of a rubber ball, and they could affect women in many different ways.
We've seen that the numbers are significant, with up to 77% of women expected to develop fibroids before menopause. What symptoms should women be paying attention to, and when should they seek medical care?
Yeah, so just to go emphasize the importance of fibroids real quick. So yeah, you're right. About 70 to 80% of women develop fibroids by the age of 50. Of those, about 50% have symptoms, and about 25% have symptoms severe enough that require some sort of intervention. Symptoms that women should look out for are heavy menstrual bleeding, passing clots during their menses, menstrual cycles that last more than 7 days, women that have pelvic pain, pelvic bloating. Some of the pelvic pain and bloating and pressure may include urinary frequency or constipation. Some women may experience pain with intercourse, and some may also experience infertility related to fibroids.
So, for women who are diagnosed with fibroids, what treatment options are available today, and how have those options evolved over time?
So, treatment for women with fibroids really depends on whether they want to maintain the ability to have children or whether or not they want to maintain their uterus. It's generally a good idea to break it down into surgical versus non-surgical options for treating women. Non-surgical options would include birth control pills, something called a hormonal IUD. There's new medications that are relatively new in the past 2 to 3 years that are FDA approved to help treat fibroids. Those are medications that contain a medication called a GnRH antagonist, which is basically a medication that prevents the ovaries or stops the ovaries from producing hormones and helps shrink down the fibroids. Also, surgical options would include something called a uterine fibroid embolization procedure. Also, within the past few years, there's something called the radiofrequency ablation of fibroids, which is relatively new, that can help manage fibroids. And then myomectomy, or removing fibroids, is usually what's recommended in women that want to maintain the ability to have children. Usually that's the best option. And then ultimately, the definitive treatment would be a hysterectomy if that's what the woman desired.
So, what are you seeing here in New Jersey? How is this condition impacting women here? And are there any unique challenges patients in our state face when it comes to diagnosis or treatment?
Yeah, so a lot of the women that I see are anemic, or their blood counts are very low. They've been walking around having fibroids but not knowing it. It's important to note that about 30% of women that have fibroids don't get a diagnosis for about 4 to 5 years later. So there's a delay in diagnosis. Basically, I think that in our state, we're one of the most densely populated states, or the most densely populated state in the country. Oftentimes, there's a lot of doctors and a lot of noise out there about, what is recommended or not. So I think educating the population and women about finding the appropriate doctor and expert in the field is of the utmost importance.
So, is there any preventative care that women can take?
So we don't really know about any preventative care. Nothing's really been proven to prevent fibroids from developing. Some anecdotal evidence is, decrease the amount of red meat, maybe your diet, watching what you eat, may be helpful. Studies haven't really confirmed that, but there's some belief that that could help. And even if it doesn't, overall, it's good for your body in general.
And research shows that fibroids disproportionately affect Black women and other women of color. What needs to be done to address these healthcare disparities and improve outcomes for all patients?
Yeah, so that's accurate. So earlier I said that about 70 to 80% of women develop fibroids by 50. It's about 80% for African American women develop fibroids by 50. Also, African American women tend to present earlier with fibroids, and the disease burden is usually worse for them. I think that one of the keys is educating not only patients, but primary care physicians so that they're aware of fibroids and the things that they can cause, and just getting knowledge out there and making everybody aware about it.
What's the one message you'd like women watching at home to take away during Uterine Fibroid Awareness Month?
The one message is education is key. Education is power. Hysterectomies are the second most common major surgery performed on women, only behind cesarean section. The most common cause for hysterectomies are fibroids. And of all women that have a hysterectomy, 60% are never offered an alternative to a hysterectomy. So that's a very large number, and I think it's very important that women are their own advocates, that they do their own research, and for us as physicians to get out and again educate the population, and also as a expert in fibroids, to educate primary care physicians to better open up access for these patients.
What other resources are out there for women that may think they have this condition?
So there's some websites, ACOG, American College of Obstetrics and Gynecology, going on the internet and doing some research in that way, and speaking with your primary OB/GYN about perhaps getting a referral to a specialist in fibroids.
Dr. Eric Lieberman, thank you so much.
Thank you very much. It was a pleasure.